how can the common man register for the vaccine at the moment? We understand it's healthcare workers first, then frontline workers, then the elderly, then those with comorbid conditions. What about the common healthy person who wants the vaccine?
So the first group is going to be the priority group, and as you rightly
Yes.
said, it's basically 3 or 4 groups if you want to put it that way. One is of course the frontline workers, the healthcare workers, and the third is those who are over the age of 50 with or without comorbidities, and then is those less than those individuals who are less than 50 years but have comorbidities which makes them at a higher risk of getting more severe COVID-19 infection. So that is going to be the first group, and if one is not in that group and is in a low priority group, then you will have to wait for some time, because once this group is vaccinated, and this is around 30 crores, then one will be able to say that you can register, and then your turn would come. For those who fall into this group, the mechanism, of course, the government is working on doing a lot of database being uploaded itself. The healthcare worker database has already been given by states and by the central government, which can be uploaded onto the platform. The frontline worker database is also there from states and the central government. We have the electoral roll for individuals over the age of 50, and that will be also used to identify individuals who are over the age of 50 and need to be vaccinated. But if someone is left out, then there is a mechanism that he can register himself on the CoWIN platform by showing or uploading his identity card, which could be an Aadhaar card, it could be your voter ID card, it could be your passbook, it could be passport. There's a whole list of things that can be uploaded, and with your mobile number, and you will get an OTP, and then subsequently you will be registered. And on that mobile number, you will get to know when is your date for the vaccination and where you have to come.
But when is that date? I think that's the other crucial question for the average person who doesn't fall into the priority groups. What's the kind of timeline that we're looking at?
So this is a tough question, because it will depend on the number of doses that we will have available over a period of time. And if we have multiple vaccines, and I'm hopeful that by March we will have more than 2 or 3 companies coming in to provide us the vaccine, we will have even possibly Dr. Reddy's laboratory with the Russian vaccine, the Sputnik-V, and maybe Zydus Cadila with their vaccine, having finished their trial. That will increase the number of doses that we have. That will help us to decide when will we finish our first priority list. Hopefully we can do it in the first 4 to 6 months, but the rate limiting factor are two. One is the number of doses available, and secondly is how do we roll it out multiple times, because we have to give 2 doses. So how do we roll it out multiple times so that everyone who is in the priority group gets covered and gets the second dose also.
Right. We'll talk about Sputnik-V and Zydus Cadila, subsequently, but Bharat Biotech vaccine was approved without efficacy data, and there was a huge storm that was created. How will we know if Covaxin actually works, because the efficacy data is not known to the public?
So there's immunogenicity data which suggests that it should work. It's very robust, and it's now in the public domain. There is a preprint article also which Bharat Biotech has put out, which regarding the immunogenicity data. But I do agree that the final proof does lie in showing that in clinical trial, phase 3 clinical trial, the efficacy is there. That study, I'm hopeful, would be over by February, and we should have data which will be accepted by the regulators, I hope, and by the subject expert committee, if that data is robust enough. And then this vaccine approval will move up as what Serum Institute has got. This is still in a clinical trial mode. So I'm hopeful that by the time we will be able to do that in the next, let's say, 4 to 6 weeks.
All right.